Good morning, everyone. Thank you for joining us this morning. We'll give it a couple minutes here just to give some time for folks to join us, and then we'll go ahead and get started with today's presentation. We'll give it just another minute here, and then we'll get started. But thank you for being here. I see more people are joining us, so glad to have you all. All right, so I think we can go ahead and get started. Again, good morning, everyone. Thanks for joining us for today's Walk Here's Conversations webinar. Today we'll be talking about building a support system as you age. So we're really excited to get into all that information here soon. My name is Sebastian. I'm the Walk Cares Fund Outreach and Language Access Lead. And we're going to take a second here just to meet the rest of the panelists. So I'll start with Logan, and then we can kind of popcorn around.
Morning, everybody. My name is Logan Sargent. I'm the other outreach lead with the Walk Cares Fund. I'll go ahead and pass it over to Lucy.
Hi, my name's Lacey. I am the Marketing and Enrollment Specialist with Providence PACE. And I'll pass it to Melissa.
Hey everyone, I'm Melissa Temke. I am the Behavioral Health Communications Manager for the Healthcare Authority.
Awesome. Thank you all for that. And we'll hear from them here in a second. But just before we get to the information today, just a few housekeeping things to mention. If anyone has joined us on a computer or if they're using the Zoom app on their phones, you can submit your questions through the Q&A function at any point in the presentation, throughout the presentation. We'll have a Q&A section at the very end. If we're unable to answer your question during today's Q&A time, you can also email us through the Contact Us form on our website, walkcaresfund.wa.gov/contact for a response. Today's webinar will be recorded, and the recording along with the slides will also be available on our website, walkcaresfund.wa.gov/webinars within 24 hours of the completion of today's presentation. So with that, I'll go ahead and pass it off to Logan, who's going to start the conversation today, sharing a little bit about why a program like Walk Cares is needed.
Great. Thanks, Sebastian. We'll go ahead and go to that first slide there. Yeah, so a program like the Walk Cares Fund is needed because the way that we have been paying for long-term care in the state of Washington up till now simply is just not working. Even though 70% of us will need long-term care at some point in time in our lives, most of us just cannot afford it. The cost for just 20 hours of in-home care per week is over $23,000 for 6 months. Other types of long-term care are even more expensive. Median household income for Washington State seniors is just $69,000 per year. So family caregivers have to step in to fill that financial gap, either with their own savings or providing care for a loved one. Almost half reported a related financial setback, and they spend on average around 26% of their own income on care-related expenses. So a public insurance program like the Walk Cares Fund gives workers more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and when their income is higher. Then they can access money to pay for the care they need later on in life when they're on a fixed income. Covering all workers also helps keep contributions low. Once they retire, their contributions will stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people need access to care. Unlike private insurances, which typically require you to pay out of pocket for the first 90 days before you can access benefits, WellCare's fund has no deductible or waiting period. Next slide. To earn WellCare's benefits, most Washington State workers will automatically contribute 0.58% on every paycheck during their working years. You only contribute while you're working. Contributions begin in July 2023, and everyone is covered at the same low rate regardless of pre-existing conditions. You'll need to meet a contribution requirement and a care needs requirement. Once approved, you get to choose on how you want to utilize your benefits. The full benefit amount starts at $36,500, and that will continue to grow over time with inflation. You can use your benefits for any covered services and supports that you want. There's no out-of-pocket costs when you need care. We pay those providers directly for the services that you receive, no co-pays or deductibles. Next slide. This is what contributions would look like over the course of a typical career. A typical worker participating in the WellCare's fund earns around $59,000 a year. They'll pay $29 in contributions per month, which adds up to just over $10,000 total over a 30-year career. To earn less in benefits than you contribute, you'd have to make on average around $100,000 a year for a period of paying to the fund for 30 years. Go ahead, next slide. Everyone who's contributing to the WellCare's fund more than 500 hours per calendar year is earning benefits, so that includes the part-time and temporary workers are also included. To qualify for benefits, you have to meet the contribution requirement through one of our three pathways. First is what we call the permanent pathway. This will earn you lifetime access to that full benefit amount by contributing to the fund for at least 10 years. The next is what we call the temporary pathway. This will earn you access to that full benefit amount once you contribute to the fund for 3 of the last 6 years at the time that you apply for benefits. This is designed for people who have contributed recently at the point where they need care but haven't earned that permanent access yet. In 2026, applicants who have contributed for 3 years at any point in the program can qualify through this pathway. Next is what we have, what's called the transition pathway. This will earn permanent access to 10% of the full benefit amount for each year that you contribute. If you're born before 1968, for example, you would contribute up to 2 years, you'd earn 20% of the benefit amount, or roughly around $7,300. And this was really designed for people near retirement at the program launch who might not be able to earn that permanent access to the full benefit amount. And these workers can also earn the full benefit amount if they choose to qualify through another pathway as well. Next slide. To use your benefits, we must determine that you need help with at least 3 more activities of daily living and will continue to need help for at least 90 days. The activities that we consider are bathing, bed mobility, transporting, toileting, mobility, eating, medication management. And we'll count any activities that you need supervision to complete, like someone monitoring you, reminding you to start or keep going with an activity or task, or helping you to set up. Next slide. When you're ready to apply for benefits, you'll start by creating an online account. If you need help managing your account, you can set up an authorized user, like a loved one to be representative. And you can also get help with your application from your local area agency on aging to call us to apply over the phone. Once you submit your application, we'll confirm that you've met the contribution requirement, and then you'll be able to schedule an appointment to talk about your care needs. After we've met with you, we'll let you know if you're approved to start utilizing your benefits. Next slide. Once you've been approved, you can use your benefits for any covered services and supports from a WellCare's fund provider. You may want to choose services to help safely in your own home, like in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support those family caregivers. You can get paid care from a loved one even your spouse, or you can get respite care so they can take a break. We cover education, consultation, help them manage your care, dementia, behavioral supports, care transition, coordination to support when you leave a facility like a hospital. You also choose to receive services in your own community, like an adult family home and adult day services, or you can choose to receive care in an assisted living facility or nursing home, even including memory care. Next slide. You might be wondering how far your benefit amount will go. About a third of people need care for just a year or less. For those people, depending on the services that they choose, WellCare's fund may be able to cover all or most of the care that they need. For others, the WellCare's fund can provide your family with immediate relief and time to plan for future care costs. Here on the slide are a few examples how you might utilize your benefits. If you'd like to pay a family member for your care, you can receive care for 10 hours per week for 2 years. Get care supplies for around $35,000. If you want to make your home more accessible, keep living there independently, you can make home modifications, install a personal emergency response system, get meals delivered for 3 years for around $36,000. If you need short-term help after an accident, you can get in-home care for 20 hours per week for 6 months, install a wheelchair ramp, buy safety equipment for less than $29,000. Next slide. WellCares provides a modest benefit for a modest premium. You might want additional coverage in case you need care for longer, a more expensive facility. The legislature created a standard for supplemental private insurance policies that are designed to work alongside the WellCares fund benefit. This is very similar to how Medicare works. The public insurance provides a foundation, financial security for everyone, and private options are available for those that want more coverage. Supplemental private policies will also kick in seamlessly once you utilize your WellCares fund benefit. And the supplemental market will give consumers options of coverage for coverage amount and prices, but policies should be more affordable than current private insurance policies since WellCares fund will cover those deductibles. Policies will also have more consumer protections. The Office of the Insurance Commissioner completed rulemaking in May of 2026, and policies could become available by early the year 2027. Next slide. You can choose to continue participating in the WellCares fund if you leave the state of Washington. To become an out-of-state participant, you must contribute to the fund for at least 3 years where you worked that minimum 500 hours per year and must opt in within a year of leaving the state of Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. And while we're working on a process for out-of-state participants to report their earnings, pay premiums with a focus making on it easy as possible for those individuals. Starting July of 2030, out-of-state participants will be able to access those benefits even if they move outside of the state of Washington. This time, I'll pass it over to Lacey.
Thank you. All right, so I'm Lacey and I'm the Marketing and Intake Specialist for the PACE program. PACE stands for Program of All-Inclusive Care for the Elderly. Sorry, put my camera on. This program provides a comprehensive service package where all your needs are coordinated by one provider. We become your primary provider, your healthcare coordinator, and your insurance. We cover transportation to all medical appointments, vision, dental, hearing, foot care, all medications, including over-the-counter medications, any incontinence supplies or nutritional supplements. Your team provides individualized attention based on your needs and preferences. Some other advantages of enrolling with PACE include individualized care planning, geriatric trained physicians and nurse practitioners, inpatient hospital care and outpatient surgery, specialty medical care, physical, occupation, and speech therapies, all necessary equipment and medical supplies, recreational and therapeutic activities, physicians and nursing staff coverage 24 hours a day, 7 days a week, including holidays, clearly defined costs with no deductibles, co-payments, or claim forms, long-term care coverage, in-home care and caregiving services, support for family caregivers. PACE program currently exists in 33 states and the District of Columbia. We have 191 PACE organizations and 359 PACE centers as of February 2025, and we are growing. To be eligible to enroll in the PACE program, you need to be 55 and over, live in a PACE service area, need certified to need nursing home care, able to safely live in the community, and Medicaid eligible. Next slide. 95% live in the community. The average age is 77. 66% of that is women and 34% are men. When I talk about help with activities of daily living, that is dressing, bathing, transferring, toileting, eating, or walking. I think they need to have 2 or 3 of those to be eligible. Next slide. So the goal of the PACE program is to provide you with the opportunity to safely live in the community as your medical needs change without having to move into a nursing home or skilled nursing facility. We provide you with a wide range of services and additional medical support targeted to provide patient-centered care and flexibility. At PACE, we take our time with our participants. We address most issues as they arise without the need to have a participant wait for more than a day or 2 to be seen by their PCP if needed, while also arranging the transportation so that you don't have to. The team meets on a weekly basis to discuss each participant and their current needs. We help you maintain your health and independence while providing a wraparound support service. So the team includes a primary provider, a registered nurse, a social worker, physical therapist, occupational therapist, a recreational therapist, mental health provider, pharmacist, dietitian, in-home care coordinator, van driver, and chaplain. And so all of those people support the participant in remaining living in their home for as long as possible. PACE uses Medicare and Medicaid funds to cover all your medical necessary care and services. You have a team of healthcare professionals to help you make your healthcare decisions. Your team is experienced in caring for people like you. They get to know you, what kind of living situation you're in, and what your preferences are. You and your family participate as the team develops and updates your plan of care and your goals in the program. PACE programs are provider-sponsored health plans. This means your PACE doctor and other care providers are also the people who work with you to make decisions about your care. No higher authorities will overrule what you, your doctor, and other care providers agree is best for you. And I will pass it on to the next presenter.
All right, thanks, Lacey. Hi, everyone. Melissa again. I am going to kind of change a little bit and talk about some resources that are available if you or a family member or a loved one is seeking mental health help. The Healthcare Authority partnered with the public relations firm, DH, to create a campaign focused on making behavioral health resources for older adults available, and also kind of addressing some of the stigma that comes with people getting older and thinking that things like depression or not being excited about things anymore are normal parts of aging, because they're not. And so we put together this campaign that I will talk about. So go ahead and go to the next slide, please. The goals of the campaign were to educate older adults, and we define older adult, I don't really like that word, but what it's as people 65 and older. We wanted to help them kind of reduce the stigma associated with seeking behavioral health treatment. And we wanted to also communicate what the benefits of treatment are. And we wanted to connect people with available services and programs. Go ahead and go to the next slide. So we did this in various different ways. We spent about a year in the field doing research and evaluation. So the first thing that we did is we did a statewide survey for adults asking if they had access to behavioral health and if it went well. If it didn't go well, And if they didn't access it, why didn't they access it? And what we learned is that it can be very hard to find a behavioral health provider in our state. We also kind of analyzed our findings of that survey to come up with some concepts of the campaign. And then we got together listening sessions and focus groups. We did 4 focus groups across the state in various areas with about 5 to 10 individuals in each group. And it was really amazing and enlightening to hear these people's stories. And the one constant in every focus group and every conversation is everybody had experiences with mental health or substance use disorder, whether it was in their family, whether it was them personally. This is a common theme across everybody. So that was great to see. And then the other piece is we showed them 3 concepts, and they really kind of wanted to use all the concepts or combine the concepts into one idea. But what we ended up doing is we came up with the concept, See How I Feel, because we wanted to kind of help people think about how am I feeling, and do I want to keep feeling this way, or do I want to try and get help to feel better? Go ahead and go to the next slide. So this is what the concept looks like. These are, this is some pictures from our videos. We have an English and Spanish version of the campaign. So for the English version, the PSA focuses on symptom recognition. There's a really great video that we can see where this man here talks about how he felt like everything was gray and he felt like that he was underwater. And then he was able to find mental health support and he felt better. We also have a Spanish version of the See How I Feel campaign, and that is more focused on treatment options for things like depression or substance use. Go ahead and go to the next slide. So on the website, there is several different toolkits that you can access. They're free. You can print them out. If you want materials mailed to you, you can email me and I can send them to you. But we have an information booklet. We have conversation guides. So if you were talking to your family or your friends, and it kind of just gives you some guides on what to say and how to say it. If you're looking for yourself, we have some guides. We have guides for professionals and for providers and clinicians. We also have a variety of posters, we have postcards, and then we also have LinkedIn and email packages for providers that includes banners and graphic and some messaging. We also have some social media posts on there. Go ahead and go to the next slide. So I definitely encourage you to visit the website, seehowifeel.org. It has a plethora of really great resources about mental health and recognizing when you might need some mental health support on there. And I will put my email in the chat, and please feel free to reach out with me if you have questions or you want to utilize any of these resources. Thanks.
Awesome. Thank you, Melissa, Lacey, and Logan for sharing. We'll open it up for questions. If anyone has any questions for any of the panelists, feel free to enter them in the Q&A function there. Looks like we have a question from Cindy, how to order the materials. I'm wondering, Cindy, if you're referencing these last materials that Melissa mentioned. Yeah, Melissa, if you want to share.
Yes, Cindy, you are welcome to visit the website and then reach out to me if there's particular materials that you're interested in from the website. I can get those to you.
Awesome. Oh, looks like Lacey is replying to the question about if PACE is available in Oregon. So thank you, Lacey, for that. Question for you, Melissa, why the different orientations for the English-speaking videos focus on feelings and the Spanish-speaking videos that focus on treatment?
That's a really great question. We had Spanish-speaking focus groups, and we had English-speaking focus groups. And what really resonated more with the Spanish-speaking focus groups was the treatment focus, and what resonated more with the English focus groups was the feelings part and the like. I don't know if this feeling is normal, and I want to find out if it's normal. That's why.
Question here, can you speak more on rural context as a contributing factor to mental health, loneliness, and or access to in-person behavioral health services? I'm not sure if either or both of you,
Is that
at least you want to, speak to that one.
and where I'm not seeing the questions. So was it regarding more context around access of it
Yeah, I can repeat it one more time.
or lack of access?
Yeah, more lack of access in rural
Okay.
contexts. Yeah, with mental health and loneliness and access to in-person behavioral health services.
Yeah, I think there is across our state, we know there is, especially in rural areas, there is a limited number of behavioral health providers that are there. And so I think if you're not used to accessing them, if you're not used to reaching out and going through your primary care provider to get a referral for a mental health therapist, I think that process can sometimes be long and kind of confusing if you haven't ever done it. And I think that we need more behavioral health providers across our state. Hope that helps.
And then let's see, live in Spokane as a home health and hospice social worker. Oh yeah, so Katie, the slides will be available on our website within 24 hours. And looks like Katie's also requesting information about PACE, and she shared her email there in the chat, Lacey, as well. Any other questions that folks may have? It looks like Mariana is looking for is it Melissa's email?
Oh,
I know Melissa shared it in the chat, but it looks
I
like they're not
sent
able to see it.
here,
Oh,
I
okay.
will type it right now.
Perfect.
Yeah, sorry about that.
No,
Here
no
you go.
worries. Thank you. A question about if you refer clients to AFH, the adult family homes. I believe that.
Would be for me.
Yeah, I think so.
Yes, we do. If we believe that somebody needs a higher level of care, we do refer them to an adult family home, and we help them in that process on making sure we find them a good fit.
Awesome. Thank you, Lacey. Any other questions? We still have plenty of time, so. And if you do think of questions after we finish today's webinar, of course, you can email us on our contact us form on our website and ask your question there as well. All right, I'll wait a little bit longer, and then if not, we can start to wrap up for today. All right, I think we'll I have a few more things to share with you all before we wrap up. Again, if you have any further questions after today's webinar, feel free to connect with us over our contact us form. We'd also love to hear from you and appreciate if you could take some time to just share some thoughts about today's presentation. There will be a survey that will automatically appear once you leave the meeting. So again, if you can take just a couple minutes to fill that out, that really helps us improve these webinars. And lastly, I guess thank you for joining us for today's webinar. The information again is on our website. We have our webinars page, wacareswan.wa.gov/webinars. So you'll see again the recording and the slides of this webinar posted there soon. And here's just some links to our toolkit materials in case that is helpful or you all are able to share those with your networks as well. So thank you all again. Hope you all enjoy the rest of your day and hope to see you soon.
Thank you.